Hey everybody, Todd here. Welcome back to another Wellness Talks. Today I'm just going to be answering a couple questions. And I picked two of them because they're very similar. So I think that if I answer the one, some of the answers to that one will fill in for both of them. And they basically both have to deal with ending therapy sessions. So the first question is from Melissa, sent through my website, aquatherapies.com. And of course, you can send a message to me through my other website as well, ToddSchmenk.com. You can leave a question posted below, or you can even send me an email. It doesn't matter. When I get these in, what I do is I put them in a list. I will get to you. I haven't forgotten about you. And as soon as I have an opportunity, I will throw together an answer, just like you're getting here. So here's the question from Melissa. How do I stop going to therapy? Can I just text my therapist and say, hey, I'm done? I've been going for quite some time and I'm not sure that this is working for me. So how do we stop going to therapy? Well, a lot of different indicators here. First thing I want to play around with this question is, I've been going for many months and I'm not sure if it's working. Well, how many is many months? And if it's been quite a while, then I would actually bring this question right into session. This is a great question. Hey, and I've had somebody sit there, Todd, I'm wondering, where is this going? Because I feel like I've gotten something out of this or I haven't gotten some out of this. And we make it present. We bring it right into the moment. It's a fantastic question to bring up. Your therapist is actually trying to gauge and figure out, is this working for you? Especially if they're not using any kind of assessment. So I typically like to use particular questions that help me to gauge whether or not we're moving. A lot of ACT therapists will actually use something called a hexaflex assessment, where we're just keeping track. So that way we can avoid this kind of a scenario. And then perhaps you have thought about this and you've been thinking about this for a little while. You can just simply tell them next time you're in, hey, I think we're done with this. I think I'd like to end all this. It's not unusual to send a text or to make a phone call and say, hey, I think I'm good. I think I'm good for that right now. Now, if you're not, then that would be worth taking a closer look at as well. What are we doing here? Is there something about being in session, being in therapy, which is uncomfortable? And so we're just going to avoid that. Are we escaping, controlling, or avoiding? Like we're doing something and now we thought that this was going to give us an immediate answer and it didn't. And so therefore, I'm going to cut it off because, we're going to go into some place which is not comfortable. And well, that's partly why you go in the first place, is to be with somebody who is non-judgmental, who can just sit there with you, who can be there with you and help you to just see what's going on. And sometimes all you need is a therapist just to listen and then to just reflect back. And then you're like, oh, that doesn't sound good. And you actually come up with your own solution. I mean, oftentimes I find most people are coming up with their own solution. It's just I allowed a space, because where else can you go where you're not going to have somebody trying to fix it, somebody trying to push you in a particular direction and actually says, hey, do you notice that you tend to do this kind of a process or procedure when you're in this situation? And you're like, no, I didn't notice that. That's worth the time and the investment in being there, wouldn't you say? But that doesn't always happen right away. It could take a couple sessions. It could be 3 months. It could be 5 months. And that actually dovetails really nicely with the next question that I got from Robert. So Robert says, I once heard a therapist say that if you go to therapy for longer than 5 sessions, that either the therapeutic approach, the therapist, or I guess even both, is not a good fit, and you should look and try to find somebody else. I found that sometimes, rarely, 3-5 sessions, something does get unhooked. Like you've been chewing on it for quite some time and you were ready. And there is something called the Readiness to Change Scale. It's by Dr. Prochaska. He came up with it out of the University of Rhode Island. And it's something I've been familiar with because that Readiness to Change scale is something that's also used in public health, my prior life before jumping into mental health counseling. And readiness to change is incredibly important because when you're sitting there, maybe you're not ready to actually really get into and play with that. And if it's a trauma, you may not be ready to play around with it at all. So 5 sessions for something that you're already ready to do something about, that might be realistic. But I've often than not, I've actually found that it usually takes 5 to 8 sessions to really build a strong rapport, to get a very good base of comfort so that you can actually come in and know, hey, we can dip down into this and then we're going to come back out of this, and that I'll be able to walk away with this, process it, and start the healing process, or notice that there's a thought which dominates my life, or notice that there's a behavior that I didn't even know was there. That takes a little while to actually get to that point, especially when that very first session is often like getting to know each other kind of session. So 5 sessions is really a lot of pressure and it's probably an unrealistic expectation to think that I'm going to get in there and get out of there in 5 sessions. Also, it also sounds like perhaps when we think of I'm going to get in and get out in 5, it's just another way to try to control. I'm actually trying to come up with a solution to the problem. And in a way, that's what therapy is all about. But it's falling back and actually being in the process, noticing your actual process. And that typically takes a little bit longer than 5 sessions. So answering both of these questions for Melissa and for Robert, when is a good time to end therapy? How long are you willing to engage? What are the main goals? And you can have these types of discussions with your therapists as well. A lot of therapists will lead you through this kind of a discussion. If they don't get there, maybe they're taking a little bit longer to build rapport. Maybe their approach is a little bit more passive and they sit back. All of the approaches work. Actually, there's plenty of research that shows that the approach is actually not as important as the rapport itself. And the level of experience, if a person has been practicing mental health for 20 years compared to a person who's been practicing mental health or psychotherapy for 2 years, they found that there's really not much difference between the two. It really comes down to the rapport. Do you like the person that you're working with? If that's not the case, just let the therapist know, hey, this isn't working for me, this isn't really my approach, I'd really like something else, and go find somebody else. And there have been a few times where somebody's like, I don't know if this is what I need right now. And I'm like, that's fine. Can I help you find somebody? What are you looking more for? What do you like and not like about working with me? And if they give me a general sense, and I'll be like, okay, I know somebody I think might actually be a better fit for you. If you'd like, here's the number, here's the name, here's the number. Go on out and try it. So the length of therapy can be, I've worked with some people for 2.5 years. And it also depends on how often you're coming in, how consistent you are. Sometimes it deals with what it is that you're actually dealing with. I do a lot with chronic health issues. So at first I will meet with somebody right when they first got the diagnosis, which is difficult to handle. And I'll be meeting with them every single week, maybe 6, 8, 10, 12, 15 sessions, 15 weeks in a row. And then once they start to feel more confident, once they are feeling more competent about handling the situation, they've learned some emotional regulation techniques, they can defuse and decrease the level of anxiety or pain that they're experiencing, then that's usually like a natural break in the conversation here, and we'll push out to every 2 weeks, and then maybe every 3 weeks, and then I'll see them once a month. And like I said, with the chronic health issues, it's not uncommon for me to see them coming back once in a while just to get a little bit of a tune-up, is how I like to look at it. I mean, you go to your dentist once or twice a year. So basically, they're doing a checkup to make sure that there's nothing wrong. And that is something that's completely feasible when it comes to working with a therapist. I like to think of it as you're coming in and you're on a trajectory which is heading in this direction. You know it's heading in this direction. And my job is to actually work with you, look at the processes, introduce some new skills, and then watch for this type of a correction. And once you've reached this point, I can pull away and away you go. And then over time, you bump into something else and you start to slide back down. You come back in, we just do a quick tune-up, just readjust everything right back up, and away you go. When it comes to the amount of time, the minimum, should I be ready in 5? Should I be going for several months? That depends on what it is that you've set up in the actual plan. That depends on the level of the rapport. That depends on the situation that you're actually dealing with. Is it more severe? And then it's also not uncommon when people come in that we'll address the initial component and then we'll find that there was something actually underneath that, and therefore we go 5, 6, 8, 12. find that, work on that, there's an adjustment, and then you go, hey, since it worked here, can I do this here? And we can then start to generalize the skill so that it actually works across the board. Those are by far some of the best cases, the best case scenarios, because obviously I would love it when you're done that you have a new skill that you can generalize to all different life domains or different aspects of your life. Of course, if you have any other questions, please feel free to reach out to me. And in the meantime, until the next time, may you be well. Thank you so much for watching the video. I hope that you found something valuable here, even if it was just a little bit, because one of my main goals is just trying to make your life 1% better now than it was at the beginning of this video. And of course, as always, if you like what you saw here, please feel free to subscribe. And until the next time, may you be well.